So topics we're going to be discussing are the different types of age groups. We'll discuss all these in depth, so I won't go through the list right now, but this is all the different types of age groups. Nice little picture of a newborn infant right there. So what you're going to be seeing physiologically with infants. Usually they're going to be around 6 to 7 pounds at birth, which is translated to 3 to 3.5 kilograms at birth. Just so you know for reference, because we do use kilograms in medicine, 1 kilogram equals 2.2 pounds. So if you have someone who says whatever their weight is, if their weight is 220 pounds, you have to take that number and divide it by 2.2. So a 220 pound person divided by 2.2 would be 100 kilograms. Or right here you can see 3 kilograms is 6.6, 3.5 is 7.7. So just a brief note on that. After they're born, the first 6 months of life, their weight doubles, and then it triples by the time that they hit 1 year. So this is where we really have a huge amount of growth in terms of doubling and tripling our size. So in relation to the size of a person, this is where you have the most exponential growth. You're going to have the most weight gain growth in your adolescence, which we'll talk about in a little bit. Some things you might see that are special to infants. Their head is about 25% of their total body weight, because your brain has to be somewhat big when you're born to operate all your vital functions. So it does take up a much bigger percentage of your body weight than what adults have. Because of that, it's really hard for them to hold their head up, both because they don't have the muscle development in their neck to hold their head up, and also because it's a very heavy object compared to the rest of their body. So keep that in mind with newborn infants especially, that they cannot support their own head. That's why we always have to say hold the head. A few other things, as we discussed with anatomy and physiology briefly, their airway is more narrow than ours, and it's very easily obstructed. And also their nose and diaphragm are used for breathing. Infants, especially newborn ones, are obligate nose breathers. So that means that they really, really prefer to breathe through their nose instead of their mouth. So if you have any obstruction in the nose, that can lead to some difficulty breathing. And so if an infant's having a lot of distress, take a look up their nose, make sure that it's not full of mucus or anything like that, because if we clear the mucus, it can sometimes resolve the issue. So just keep that in mind, that infants love to breathe through their nose, not their mouth. When infants are born, they have some antibodies inside of them that's been passed from the mother's immune system to them. They also get more of those through breastfeeding. This kind of helps us take the gap and give us a buffer between womb and real life, where they get to develop their own antibodies. So this gives them a little bit of protection until their own immune system can kick in and form some antibodies. They do have a number of different reflexes that we see in just infants. The first one is the moral reflex, which is the startle reflex. So if you startle them, they're going to throw their arms out, spread their fingers, and grab with their fingers and arms any object around them. Another one, this is probably the most prevalent one that people see and do, is called the palmar reflex. That's if you put something in their palm, they're going to grab it. So a lot of people put their finger in their palm and they'll grab their finger, and they really won't let go for quite some time. You usually have to pull your finger out. The next one is called the rooting reflex. That goes hand in hand with the next one we're going to be talking about, which is the sucking reflex. But rooting and sucking are for feeding. So if you touch their cheek, they're going to turn their head towards your cheek. So if there's something to feed them with, they're turning to be fed from that side. And like I said, that goes hand in hand with the next one, which is the sucking reflex. That is when you touch their lips, they're going to start sucking. So if you stroke their lips, they'll suck. That's the reflex for a nipple. So if a breast touches their cheek, they turn and then they find the nipple and they start sucking when the nipple strokes their lips. So those are all the different reflexes that we'll see. Like I said, a lot of these dissipate pretty quickly. Probably around the first 6 months is when you're going to see a lot of these dissipating. As far as sleep patterns go, newborns like to sleep a lot. When you're a newborn, you're sleeping about 18 hours a day. Once you hit about 2 to 4 months, you start to be awake during the day and start to sleep through the night a little bit more. You'll take a few naps during the day, and then around 6 months, give or take, you're going to be up most of the day and then sleep most of the night. And you're still going for 12 to 14 hours of sleep, but you start to regulate it more. Newborns are very sporadic. They'll be up for 20 minutes, sleep for a few hours, up for another 30 minutes, sleep for a few hours. And that transitions as you get a little bit older, a few months old, to actually getting some good sleep patterns of sleeping during the night and being up during the day. Your extremities start to grow, and it's from a combination of growth plates and epiphyseal plates. Some other things you might notice are fontanelles. So if you remember in A&P, we had the skull. The skull had a bunch of sutures that are the border between different plates inside of your cranium. When you're born, those sutures aren't fully sealed, especially in the front and the back. So you have a gap where you can actually go beyond the skull, and you can technically damage the brain if you poke in on there. And those areas are called fontanelles. The one in the back of the head, that's your posterior fontanelle. It closes in about 2 to 3 months. And the one in the front is called your anterior fontanelle. Closes between 9 and 18 months. The anterior one is the one that most people know about. It's referred to as the soft spot. And that's because it lasts for 9 to 18 months versus the posterior closes in 2 to 3 months. But at birth, you will have soft spots or fontanelles in both the front and the back. And those are important to keep in mind, which we'll discuss in the next slide. And so here you can see an example of a sunken fontanelle. So your fontanelle, this is the anterior one. It's right here. And you see how it dips down pretty hard. And that is as a result for a very dehydrated child. So if you see that, that can be a sign that the child really needs some hydration. So if you see a sunken fontanelle, that's where the skin kind of dips down in that area. That indicates that the child is dehydrated. When you're dehydrated, your skin kind of sucks in closer to your body because you don't have enough fluid in your interstitial spaces, as we discussed in pathophysiology. So if you're assessing a child and you see that sunken fontanelle, think dehydration right off the bat. Versus if it's bulging out at you, so you see a big bump in that area, it could indicate increased cranial pressure inside the skull, so your brain might be swelling. Don't confuse that with a child who's crying. When a child's crying, that area will bulge on its own. So take a good look at the child. If the infant is completely normal and just kind of moving around and you see a bulging area there, that's where we get concerned. If they are screaming bloody murder, which oftentimes they are, especially when we show up, then take that into account. Don't be thinking increased cranial pressure unless you have something else that makes you think about that, which we'll go through those signs and symptoms later in the class. So as far as psychosocial, we'll discuss that in all the different age groups. That's kind of how you behave with others, psychosocial. Some things that we look for are bonding. That's where you start bonding with your parent. You start recognizing who the parent is. And also the knowledge that knowing your needs will be met. So knowing that when you're hungry, you will be fed. When you need to be held, you're going to be held. So that's all bonding. Then you have trust versus mistrust. Infants really like predictable, orderly environments. They like the same environment. They don't like a lot of change. So if your environment changes, if it's irregular or disorderly, they're going to get some insecurity and anxiety. So they can trust their home environment. They can trust their parents. They can trust things that are routine to them. They're going to have some mistrust when they're placed in a disorderly or unfamiliar environment. Scaffolding, that's the term referring to kind of learning from building on what you know. So you lay one ground floor foundation, then you learn based off of that, then you learn based off that new level, then you learn based off the next level. That's a lot of what we do in classes. Yeah, that's what all of section 1 in this class has been. This is building your ground floor so that we can build off of it. So that doesn't really go away with infancy, but we can see it a lot in infants. And then temperament, that is your reaction to the environment. Some babies say that they have a good temperament because they don't cry often. Some babies have a bad temperament if they're always upset. So temperament is kind of just how the infant reacts to their environment. Okay, so this is a table we're going to see a couple times during this presentation. So right now we're going to be looking at infant and newborn, which are these top two guys right here. And in this table itself, it's divided into two separate areas because newborn covers just the first couple of days of life. Things will be a little higher than the rest of infancy. So they include on here. Our textbook doesn't really include a difference, but it is important to know that things might be a little bit different first couple days. So for pulse, we're looking around the 80 to 160 range for an infant. It will go up to 190 right out of the womb, so just know it might be a little higher when you're first born. Respirations, you're staying around 30 to 60 a minute. Temperature, you're actually going to be a little hotter than most people, which is a mechanism to help fight off any infection because you do have a weakened immune system. So you stay 99.4, 99.7, so just a little higher above what a normal adult is. And then blood pressure, systolic, which is the top number, you're looking around 74 to 100. I usually say about 80 to 100 just for ease of remembering. And your diastolic, you're looking around 50 to 70. So this table does have a lot of information in it. One of the big things I want to just point out is as we go down this table, so as we go looking down, everything, well, for pulse and respirations, they're going to start coming down, and your blood pressure is going to start coming up. So those are the two big things to know. It's just trending. As you get older, your pulse and respirations go down, and your blood pressure goes up as you age. Here's a picture of a year-old toddler. So physiologically, your pulmonary system gets a lot bigger. Your nervous system gets much more advanced. Toddler phase is where you're going to really have people talking a little bit to you. They're going to be walking. They're developing a lot of the complex parts about being an actual human. So your nervous system becomes much more advanced. Your musculoskeletal system develops much more. That's where you develop the muscles to be able to walk and to be able to pick things up and do some certain things. So that's where we start seeing a lot more movement. Your immune system starts to be formed on its own. You don't have the antibodies from your mother anymore, so your body is developing its own antibodies. A note to that is because it has to develop all your antibodies, you're going to have a lot of pathogens get in and stay in because it doesn't have anything to fight it off initially. This is why a lot of toddlers get a little sick. They have the sniffles, is what they're called a lot. Just a lot of minor little illnesses that they usually resolve within a day or two because your body will build up the antibodies and fight it off, but they will be sick for a little while. So we see this a lot in toddlers, is someone being but a little sick. Also, this is where you have your primary teeth start to come in. So that's the first set of teeth, or your baby teeth, as some people call them. Psychosocially, they start to understand that what they do has effects. So if I put my finger in an outlet, it's going to shock me. So they understand that there's a correlation between what they do and what happens. This is where they really develop some separation anxiety with their parents. This is where they'll be screaming if they don't have their parent around. This is where they start to hide behind their parent in a high pressure social situation, like when they're in public. So this is where they really start to be very, very, very attached to their parent, and they get very upset if their parent isn't around. They also start to develop imagination. This goes hand in hand with their neurological development. This is where you can start doing fun little games with them, where you can have pretend tea parties or something like that. They start to engage in play acting. So this is what a lot of parents see as very fun time with them. It's also the time of what some parents call the terrible twos, because they start to kind of branch out and have their own exploratory personality. They get very upset if something doesn't go the way that they want. So you have a lot more interaction with a child during this age group. Here's a picture of a toddler. Here's a picture of a preschooler. I'm pretty sure it's the author of our textbooks, preschooler. So physiologically, your body systems continue to develop. You're just building off of what you already had. And then psychosocially, you start developing some social skills. This is where you can put them in groups of people their age. They're going to be interacting with other kids. They're going to be playing with other kids. Separation anxiety from their parents is still there, but it's getting a little bit better. This is where you can have play dates and they're going to be okay as long as they're in a environment that they know. Especially if the parent has been there with them before, then usually the parent can leave for a little bit and they'll be okay in a familiar environment. So that is your preschool age. There's some pictures of some school-age children. So physiologically, you're still developing everything that you're building on during the preschool age. Everything's getting bigger and better. You do lose your baby teeth, which are called your primary teeth. Secondary teeth come in behind them. Those are your adult teeth or permanent teeth. Psychosocially, they have less general supervision, especially the older they get. A 12-year-old, usually you can leave alone for a short amount of time and they're going to be okay. They start to develop their own decision-making skills. They start to develop some independence. And then really big is they have awareness and development of their self-esteem. So this is where you're going to have some value to what their peers say to them. You're going to have some self-image problems. They're going to start to compare themselves to others. This is where you have a lot of emotional development And that can be positive or negative. Their self-worth really starts to develop during this age. And it's very obvious if they don't have care either at home or if they are being emotionally abused at school or anything like that. This is where you really start to see a lot of those things come out in their behavior. So right here is a picture of an adolescent. So physiologically, they're going to have a 2 to 3 year period where they have a huge growth spurt. The growth spurt usually starts with their hands and feet, and then it moves to their extremities, and then the last stage is your chest and your trunk get a lot bigger. Typically, girls finish growing by the age of about 16, and boys finish growing around the age of 18. Once you get to the end of growth, typically males are bigger and they're stronger than females. At this age, you also start to see some sexual maturity happen, both with your sexual organs and sexual interest. So this is where breasts start to develop on females. This is where the penis starts to become a little bit more enlarged in men. This is where pubic hair develops. This is where underarm hair develops. And this is where kids have a lot of interest and curiosity in sex. A lot of kids start to have sex during this time period, but also keep in mind that it is incredibly embarrassing for a lot of these adolescents. So you're going to see a lot of kids not answer sexually based questions honestly, such as if they are sexually active, especially if you have someone who you're suspecting pregnancy on. If you have, say, a 16-year-old girl that is complaining of severe abdominal pain, and it might be something called an ectopic pregnancy, which we'll cover in OBGYN. Sometimes they might not answer honestly that they're sexually active, especially if they're around their parents. So this is the age group that you have to do some questions away from their parents, which can be tough to do, but you might not get some straight answers if you don't. Especially true in anything sexually related or drugs or alcohol related. If they don't want to admit that they've been drinking or that they've been doing drugs in front of their parents, this is where you might not have honest answers. So try to get them alone, and also keep in mind that even alone, they might lie. So psychosocially, this is where you really have a big push for independence. This is where they're rebelling against authority figures, especially their parents. Your self-esteem becomes even bigger. This is where you have a lot of concern about your body image. There's a lot of peer pressure out there to do things like drugs or smoke or alcohol, which are self-destructive behaviors. They want to try things out. They want to not do what their authority figures have been saying all their life. They want to give in to peer pressure. So you have a lot of experimentation during this time, which can be very self-destructive. And the problem is they don't know about it until they try it. So we're called a lot of times when some of this experimentation goes wrong. You also have, and it's become much more prevalent in the past 10, 20 years, you have a lot of mental health problems at this time because body image and self-esteem is usually very low for this age group. So you have a lot of very depressed people who are in their adolescence ages, and a lot of these people can get to the point where they are either threatening suicide or they actually do commit suicide. So this is something that we have to be very mindful of. Don't take any threat that an adolescent says as an empty threat, because a lot of them actually do act on this. And this is something that you will probably see at some point in your career as a teenager who ended up committing suicide. So be very mindful of that. They also start to develop their personal code of ethics. This is where they start to become their own individual. So they start to think of what's right and wrong to them, and that develops into your early adult years. But this is where you really start to become an individual. So the number one issue that we see with adolescents is injuries, because they're taking risks. They're finding out what they can and can't do. They're trying to fight against what they've been told their entire life. They want to, stick it to their parents or something. So they do a lot of risky activities, and they think they aren't going to get hurt because of it. A lot of people say that teenagers think that they're invincible. That's why you see some 16 and 17-year-olds driving 150 miles an hour. They just think that they won't get harmed, or if they do get harmed, it's not going to be that bad. So a lot of these people, when they do get hurt, they might not be honest with you. This goes back to talking about like drugs or alcohol. They don't want to admit things to you or to anyone around their parent. So you do have to explain, or you have to explain to them why you need to know something and why it might help you care for them better. Yeah, we need to know how fast they were going if they got in a car accident, because you need to know what internal injuries might happen at certain speeds. So try to explain to them why you need to know, and hopefully they'll be honest, but also keep in mind that they might lie to you. So keep everything they say with a grain of salt, especially when EMS has to get involved. Here's some pictures of young adults. Physiologically, this is where you start to develop things that you're going to be doing for the rest of your life. Around age 26, you reach your peak physical condition. I really miss being 26 years old. After 26, your body starts to slow down a little bit, little by little. Psychosocially, this is where you have the highest level of job stress. This is usually where you're trying to get established in a job, you're trying to make a name for yourself. So stress levels are incredibly high when it comes to jobs. Same with family. This is where most people start their own family. So you suddenly, for one, have a spouse that you're dealing with, and then you also have your own kids that you're dealing with, which kids are incredibly stressful. So look for a lot of stress in this age group. And you have some major life events happening. Like I said, your career is a big one, marriage, childbirth, and raising children. That all happens. And your leading cause of death during early adulthood is not usually a medical problem. It's usually something accidental. So it's usually a traumatic death that is the leading cause of death for early adults. Here's a picture of a middle-aged adult. This is where things start to get a little overused and a little weaker. So they might need glasses. Vision that's lasted them for 40 years might get a little worse. This is where you have the development of heart disease, especially if you had high blood pressure during your early adult years because of all the stress. So this is where you start to have some major medical things pop up. You can have cancer pops up during this age group a lot. And your metabolism slows down quite a bit. So people tend to gain a lot more weight during this time period. Psychosocially, This is usually around the age that their kids develop their own personal lives. This is where their kids hit early adulthood. So they leave home and they can have empty nest syndrome. That's where all your kids move out and it's just you and your spouse. And you're like, well, we've been doing this for 18 years. Now what? So it can be a time of great depression. But some people do thrive. That's where some people start to travel and do things on their own. So it really depends on the couple or the person of whether empty nest is going to be good or bad. And also they have some stresses about their parents usually start to get much older, so they have to start assuming the care of their parents. So you have a lot of stress revolving around that. Keep that in mind that they might be thinking about that when you're treating them. Here's a picture of some people in their late adult years. The nickname for late adulthood is the twilight years, so just be mindful that some people might call it the twilight years. Physiologically, your body systems start to get less and less and less efficient. They start to not do the same things that they did beforehand. Your senses get diminished a lot. Your vision gets worse. Your hearing gets worse. Your sense of feel and touch gets worse. Your smell can get worse. So everything starts to slow down. This is where you start to see a lot of diseases affecting the body. Cancer becomes very prevalent. Failure of organs becomes very prevalent. So you're going to start seeing this in this stage of life. Psychosocially, their living environment might change. You might be considering how long they can stay in their primary home. Some of them have to go to assisted living facilities where you have help with meals or help with cleaning, stuff like that. You might have to go into a full-blown nursing home where you have someone taking care of basic needs. So that's where it's an ever-changing environment. And that could be a big stress of changing, going from living 30 years in the same house to having to go to an assisted living facility. A lot of adult people in the late adult period are very resistant to that. And so a lot of them are in inappropriate living environments because of that. My grandparents, for example, are pushing 90 years old and they cannot take care of themselves, but they refuse to leave the house that they're in. So that's an issue that I'm dealing with personally during the late adulthood period of my grandparents. They also have a lot of issues with self-worth at this time. They spend an entire career doing work, and they can feel like they're not being productive anymore because they aren't going to work anymore. If they're retired, they aren't taking care of their kids anymore because kids are in early or middle adulthood at this point. So trying to find reasons for them to feel important can be a challenge at that age. You also have financial burdens because most of them are not working anymore. So they live off their retirement income, pension, Medicare, Social Security. They're living off of money that they have saved up, which not everyone saves up enough. And it can get very expensive. If you have to go to nursing home care, that gets within $50,000 to $100,000 a year just for the nursing home care. So it gets very expensive very quick. And they also see a lot of death and dying among their family and their friends. People they've known all their lives start to die off or become very sick. And they also start to become very sick themselves. So it's something that they have to deal with continually and know that it's happening to them. So all these can affect your emotional state and your mental well-being. And it's something that we have to keep in mind of this is what these people are experiencing and going through. So we can be a little bit more sympathetic to it. All right, so understanding the basic physiological and psychological development for each age group will assist you in communicating with and assessing patients of various ages. That's why you saw the vital sign table a bunch, because that's imperative in our assessment, knowing what's normal and what's not normal among age groups, especially kids. Physiological differences between the ages will affect your care. Examples include differences in the respiratory systems of younger patients and the effect of pre-existing medical conditions in older patients. Infants and young children have less developed and smaller respiratory structures, which can make respiratory conditions worse. Your ability to communicate with younger patients will depend on their stage of development. This can range from fear of strangers in your toddler stage to separation anxiety from parents and embarrassment during adolescence. Older patients may have issues with denial or depression over medical conditions or other things in their life. Keep in mind that infants present massive bursts of anatomical and psychosocial development in the first year of life. Although preschoolers begin to develop independence and reason, in many ways they still resemble the psychosocial development of toddlers. Like I said, those two groups kind of go hand in hand. School-age children are often independent and logical, but they may crumble with illness or injury. And adolescents are reaching physiological maturity, but they can often face psychosocial challenges as they start to develop some independence. Early, middle, and late adults vary greatly in terms of physiological development and conditioning. They also face some psychosocial challenges unique to adulthood. So how do you approach a patient most effectively based off of developmental characteristics? So if you think of a kid, someone who's in the toddler stage, you aren't going to be communicating a lot with them directly about what's going on. You're going to be talking to their parent more, but just be very warm and smile and friendly and understand they're going to be scared of you. Versus an adolescent, they want that independence. They want to be involved in things. So talking to them, and you can talk to their parents as well, but making them involved and making them feel like they're in charge of things is huge at that age. Does the age of your patient pose any assessment or care challenges based on physiologic development? So if you think to an infant, it's going to be a lot harder to assess the vital signs on an infant. One, they won't hold still. And two, everything's much smaller. It's much harder to find than it would on a person in middle adulthood. So it's okay to tailor your assessment based off the age. If a kid, especially an infant, doesn't let you do something like take a blood pressure, but you have other signs knowing that they have a satisfactory blood pressure, which we'll talk about in pediatrics, sometimes taking a blood pressure and making the kid really upset isn't the best choice. So again, we'll get into that with pediatrics, but tailor your assessment to the age group. So you were called for abdominal pain in a 16-year-old girl. She is with friends at the park. She seems hesitant to answer any of your questions. What characteristic of adolescent development is most likely the cause of this, and how would you overcome it? Okay, so this would be a psychosocial issue. She's probably embarrassed about the pain, and if it's something to do with her menstrual cycle or something to do with her possibly being pregnant, and she's around friends, she's not going to want that embarrassment around her peers. So being able to take her into private to talk about things and explain why you need to know things, like if she's sexually active, because you might need to know if she's pregnant, or if she's on her menstrual cycle at the time, that's going to be huge in your assessment and treatment of her. So being able to get her alone so she doesn't have to worry about her friends judging her or being embarrassed by anything, that's pretty big. So that brings us to the end of this chapter. It's a relatively short chapter that covers a lot of ground really quickly, and it's just things to keep in the back of your mind. Some of it might seem obvious, and especially if you've had a kid or if you have friends that are close that have had kids and you see this growth, then a lot of this should seem obvious if you have to actually experience living through this growth with someone. But it's things that we really need to keep in mind because we do need to tailor what we do to the age group. So feel free to rewind and see any group that you don't feel strong on. and we'll see you next time.